Our stated mission, really, is restoring the soul of healthcare. The soul of healthcare has been beaten out of it. Clinicians and doctors are just exhausted. They don't like what they do anymore. And you can't restore the quality of healthcare for folks that actually pay our salary without improving the lifestyle of the people that are doing it.
What is HELPcare? It is a clinic of people that I think really, truly want to help people. And it sounds a little bit cliche to say, because I think most of us go into medicine because we want to help people. But ultimately, it's hard to feel like you're doing anything good when in that short amount of time, the main thing that you can do to help anybody feel better is prescribe medications.
So really what we are about is helping people to help themselves be healthier.
This model of care has really opened up the opportunity for me to practice the way I want to practice. We really want to identify health problems early on and prevent those from progressing.
Traditional family medicine really burned me out. Just too much, too quick, not enough time with patients, and not enough time to do my favorite thing with patients, which is education.
All my life, I've wanted to have my own practice. This model of care, and with the help we have from the management part of this, I don't have to worry about the details, and I can just do what I do best, and that's caring for the patient.
This easily slops over into better healthcare for patients, and so they get a better deal, and the clinicians are not worn out and burned out.
I do really enjoy coming to work every day at HELPcare. We have 6, 7 patients a day, maybe 8 at most. Focus is on very high quality care, and not just care, but relationships. So if my nurse says something to me about a patient, I know who they're talking about, not just their medical conditions, but know them as a person and come alongside them to support their individual health goals.
The practitioners here follow the acronym GOT Life: growth mindset, ownership, teamwork, love, integrity, flexibility, and excellence.
One of the biggest things that we look for in terms of who's the right fit to join HELPcare would be somebody that's a team player, someone that is interested in learning and growing with us, and maybe wants to do things a little bit differently.
Our practice definitely has a faith foundation, and I think that's what draws a lot of people to us.
And so those values permeate the whole system. We're helping these people because we're working for somebody who tells us to help them.
I think in a big system, you're kind of stuck feeling like you're in the thick of it, and it doesn't really matter what you say. You just have to do what you're told and go to work every day. Whereas here, yeah, you can share your opinions, you can tweak your schedule, you can make it work.
This is, I think, really the answer for a lot of healthcare. And functional medicine isn't about how you get paid, it's about how you do medical care. And that is, something that just jazzes me about coming here, is that I get to do the medical care that I always kind of envisioned but didn't know that I was missing.